I'm Raegan Garber, the CEO of WeCare TLC, and I have with me Dr. Kenneth Power,
The one and only.
the one and only. We like to call him Kenny P internally. He is our medical director and also a practicing physician in one of our health centers. And Dr. Power, the reason why I am just always eternally grateful that he is our medical director and a practicing physician in one of our health centers is, to me, Dr. Power, you're the epitome of really what we do. What I want to do is I want to talk about Thrive, and I want to talk about what we're building and why it's important, and why it helps elevate our care. If I could just get from you what your summation of what Thrive is.
So, in a nutshell, Thrive is a reframing of primary care,
Mhm.
advanced primary care, we like to call it,
Exactly.
right?
Yep.
And it's this reframing of the individual as like as a metabolic picture. Thrive is not really a, a document or something you can find
Mhm.
out there. It's
No.
unique to us, and
Yep.
and it encompasses all of our knowledge, for any given issue, whether it's pre-diabetes or,
Yep.
like we said, men going through low T, these
Mhm.
kinds. This is not
Mhm.
always done the same from doctor
No,
to doctor. People will see
that's
their
right.
urologist and be told one thing. They'll go see, another doctor and be told something else. So this way we get, we no one provider, no one clinician is out there on their own. They're
Yep.
literally, using the some knowledge of the group, and it's exciting.
The
Exactly.
power of the team is somebody on the team is an expert in an area.
It reminds me of, when I went through medical school. I'm going to say it on air now. It was 30 years ago. Ugh. At the time, I remember the dean of medicine, when we were getting our robes and our
Mm.
and our placards, he was basically told, "You guys know nothing. Like you know absolutely nothing." And we're like, "Really? Because we just graduated yesterday." You know. And he said, his story was that when he graduated as a doctor, the dean of medicine, HIV wasn't even a thing, and his specialty was an AIDS doctor.
Oh, yeah.
So he had to
Yeah.
learn his entire craft
Yeah.
from scratch,
Yep.
given the basis of the knowledge he was handed with his MD. So that
Yep.
was terrifying. Like I know nothing. Like yeah. And it ended up being true because,
Mhm.
30 years ago there was, think of the things that,
Yeah.
did not exist today, almost everything.
I don't think
No
they spoke about
COVID, there
inflammation.
was, right, that's right. Inflammation was a
Yeah.
complete, you know,
Yeah.
and now we have anti-aging and
Hmm.
GLP-1s, and we have,
Yep.
revolutionary treatments for MS and
Hmm.
cancer, and it's just completely different world. So it was like medicine, the knowledge of medicine, doubles
Hmm.
every 18 months. That's like 6 months now.
Yeah.
So if you don't come together with a team, there's no way you're going to keep up.
No,
So
no.
Thrive allows us
And
to
they
stay
don't.
current.
Yeah.
Right.
Yeah.
Yeah.
And
Yeah.
that's an
Right.
excellent point. What I love about We Care TLC is that we come together as a team and collaborate and help with the nurses have their own Teams channel that they're always checking in with each other on. How are you doing this? What about this? Are you experiencing this? You host the weekly medical leadership meetings
Right.
where our nurse practitioners, physicians assistants, doctors, they all come together. But I always tell prospective clients that they're never just getting one doctor in one health center, one care team in one health center. They're getting the collective knowledge of all of our clinicians across all of our health centers. And that is what you're getting. It was something that we spoke about in a different context, but then it started taking a life form of its own. And from my perspective, this is something that truly showcases um, what we're all about as a company.
Yeah. And I concur. I think it started as an idea where we were at our annual
Mhm.
retreat and we were challenging each other at the executive level for new visions and new projects for the year. And I thought, well, maybe we should expand sort of, the vision of our delivery of primary care in such a way that meets certain patients at at a different level.
Mm-hmm.
And so my original thought was let's not give everyone the same experience. And perhaps some patients are a little extra motivated. Perhaps some patients don't have chronic conditions. They just want to optimize their health.
Mm-hmm.
And then it led to this concept of, well, why don't we optimize everyone's health? You know?
Exactly. Yeah.
I mean, everyone deserves that. It's just
Uh-huh.
that everybody starts at a different place, right? And then that evolved into Thrive. So essentially, when an individual is, you know, first getting worked up as a new patient, the doctor tends to divide and conquer using diagnostic codes. So almost instantly, you're diagnosed as pre-obesity,
Mm-hmm.
pre-hypertension,
Mm-hmm.
pre-diabetic.
Yeah.
You're pre all these things, or you're just a raging type 2 diabetic and you're just learning about it for the first time, you know. Uh, you need to eat better, you need to exercise. All these things are still appropriate. But Thrive takes a step back and says, why? Like, why am I 47 years old and my body's acting so differently when I was 45 and a half? What
Mm-hmm.
what happened? What changed, right? And usually you can start to peel away the layers if you know what you're doing and if you have the tools that we've developed with Thrive. You can break it down into one of 4 or 5 categories. It's either something going on at the insulin resistance level,
Yep.
it's either something going on at the hormonal level,
Yep.
there's been a dramatic change, right? Or you can go even deeper and say at the cellular level, at the mitochondrial level, you can see big changes. So it's we try to simplify it, but it's highly complex under the hood.
It is all of the things under the hood, and you can't treat pieces and parts, right? There
Right.
are pieces and parts, but they come together collectively and they influence each other.
It starts at the medical assistant level where they identify with 1 or 2 liners, that the patient is struggling. And, and,
Mhm.
and so they're oftentimes the first to hear that there's a new
Yep.
issue or there may be a new issue. And then that quickly, involves the RN coaches that we have
Hmm.
that's unique to us.
Yep.
And that allows them to develop or use the playbook
Yep.
that would be appropriate. So if the issue is, I noticed my blood pressure is rising and I never really had that problem before, my dentist told me or
Uh-huh.
something, it's usually a random thing, um, then the RN coach can intervene that visit.
And that's where, have the information flows from Thrive into these playbooks. The nurses can have access to that at any time.
There doesn't need to
Mhm.
be any big deal made of it. It's just that the nurse opens her playbook and activates, that Thrive domain or that Thrive pathway. And it's very, very powerful from a motivational point of view to have the nurses involved. I think we
Yes.
should we should sum up by saying that they are a critical part of the team. This
Yes.
couldn't really work without them. And
Yes.
it's again a unique part of you can't just copy paste this program and throw it
No.
into any other model because
No.
we have the people that makes
Hmm.
the model possible, right?
That's right.
With
Yep.
motivational interviewing and motivational follow-up sessions and then all the technology roped in. And when an individual is enrolled into one of our health centers, they're going to receive at some point multiple vials of blood, drawn from them. And and it's tempting to become hyper focused on lab values and normal ranges and this sort of a thing. But usually what happens is people get blood drawn and then they just immediately, throw all that into Google or some, AI interpretive program and they get told inevitably that everything is in the normal range.
Hmm.
And so this normal range thing, this normal range concept is very dangerous because ultimately you're just spitting back to the person that, yeah, it looks as if this is not technically an autopsy report. Like
Hmm.
you are
Yeah.
alive. Oh, great, I'm alive. I'm normal. But if I'm normal, like all the other people around me, like how am I getting ahead in my
Yeah.
health? What does this got to do with
Hmm.
me, that the fact that I'm normal?
Well,
And
and I think
yeah,
it can also reinforce bad behaviors,
right.
right? Because if people aren't eating correctly, or they might be drinking a little much or whatever,
Right.
and they see that you're in the normal range, they're like, yes, I can
Not doing
keep
too
doing
bad.
what I'm
That's
doing.
right. That's right. Doctors tend to address these page by page as well. So let's look at your CBC. Oh, I see your iron is a little bit low, That's it. Like, okay, take some iron. Oh, I see that, your triglycerides are a little bit high. Maybe you should take some fish oil. Like they always have an answer for every
Uh-huh.
abnormality
Yeah.
because that gives you three or four things to talk about and then
Hmm.
get out. Like I've got
Hmm.
10 more people to talk to today. Whereas with Thrive and the professors, what's happening is all of this data is getting morphed into a single interpretive, phenotype.
Hmm.
And basically, what happens is, metabolically speaking, the individual is either lean on the outside and running pretty lean on the inside. And that's about
Hmm.
10% of the population,
Hmm.
right? 20% maybe. The rest of us are either not too bad on the outside, but a disaster on the inside, metabolically obese internally with visceral
Yeah.
fat and
Yep.
inflammation. And,
Yep.
you know, and then you've got people that obviously no surprise, they know that they need to work on their health because,
Hmm.
they're maybe obese on the outside or they feel,
Hmm.
older than their age. Then what happens is, through a very free-flowing mechanism, data is
Hmm.
uploaded into the patient's dashboard, and we call it their
Hmm.
velocity dashboard or the
Hmm.
metabolic velocity dashboard. And it's sort of based on this whole concept of humans as as a health vector. At any given time, your health is quite stable, or things may be declining a little. And in this case, if blood pressure is rising, then you're gonna equate that on the dashboard as being an imbalance. There is a
Hmm.
vector out of place. So the nurse quickly has suggestions for the patient, how to follow up and what things to implement from a lifestyle point of view, et cetera. And then, the follow-up appointment is made.
Yeah.
And
Hmm.
that's when the clinician, the nurse practitioner, the doctor gets involved, and a evidence-based, but also a team-approved
Yep.
protocol is
Yep.
sort of at their disposal. Like we're making it sound like it's this super complicated, and it is under the
Hmm.
hood. But
Yeah.
when you see the dashboard and you see the
Hmm.
professors making their
Hmm.
recommendations as you
Yep.
go down those little spokes of the wheel, and you
Hmm.
see the central sort of vectors showing this
Yes, the
health parameter
velocity
is improving
dashboard.
and this one's
Yep.
sort of,
Yep.
starting to
Yeah.
tilt down. I mean, it's a visualization that anyone can get in an instant.
Yes.
And it's very, almost looks like an app you would put on your iPad or
Yep.
something, right? Well, what's
It
this
looks like
arrow? You know,
it reminds me, my husband's an airline pilot, and
oh
even
yeah.
when you get in his car, the
Ah,
he has tire pressure, oil, like I'm like he's like flying a plane right now. He's monitoring everything,
that's
and it is a
amazing.
dashboard monitoring every, all patients, and we could do that at a
Yep.
individual level, and we could do that at a population level.
I think most people would see it more, yeah, like a dashboard on a car.
Hmm.
What's my
Hmm.
tachometer doing? I'm running the red light here. Or
Yeah.
running the red line. I better figure out why.
It helps you see
Yeah,
when you're normal, right?
right.
And sum total, it might be okay, but you're trending in the wrong direction in this
Absolutely.
specific
Yeah, the
part. And that
inflammation.
makes it so much more approachable from a
Mm-hmm.
patient standpoint.
Yeah, and then I usually tell people, if you want to get all greens on this bad boy, like you need to be 20 years old because this is a hard work, like, and so there's an age, appropriateness
Hmm.
to it, but
Yeah.
it's exactly as you just outlined. None of it's inevitable,
Yes.
right? And it's all somewhat fixable, if that's the
Yes.
right word.
Yes.
Let's just say it's modifiable.
Hmm.
And so you can optimize many different levers of wellness. It just doesn't always, happen overnight. And so that's why the relationship is important.
Yes.
And why the dashboard shows, first of all, let's just slow down the acceleration and then turn it around.
Yeah. I had a family member, the input. So did not see a WeCare TLC provider,
Okay.
but did in the fee for service. Yearly labs were drawn. Everything was normal. I inputted them into the Thrive professor, and it gave back for the patient facing one. It said it is in summary, everything looks okay. However, it shows that you're becoming insulin resistant, and
Exactly.
that will continue. And we suggest one of the things you could do is lose weight And that was
Screen for sleep
not
apnea and all kinds of things, right?
that was not the conversation that was had at all
No,
in the other
definitely not.
doctor's office. And so the interesting thing about that is someone who was previously reticent to, because they're not fat on the outside,
Right?
right? They're not overweight.
That's right.
They're still normal,
That's right.
but maybe not headed in the right direction. So they did not necessarily feel compelled to change things in their life. But when they
Right.
saw that they were becoming insulin resistant and hear the things that could change that course, that was a powerful piece of it. And that person was self-motivated to start making some changes.
All of us have varying degrees of, metabolic challenges, and it's an
Mhm.
age-related phenomenon, multiplied or squared by your lifestyle choices,
Yep,
and the environment that you grew up in. And I mean, it's
yep,
complicated, but
yep.
ultimately, it all reaches home. And
Hmm.
so, yeah, if the traditional model is to wait, until the chest pain is there, that is an absolute failure as far as
Yes.
Thrive is concerned. We
Yep.
want to get them on spectrum 1 to 10. We want to catch them at
Yes.
a 1 or a 2,
Yeah.
where the patient feels fine, where they
Yep.
feel okay until you
Hmm.
optimize their energy and you optimize their thyroid and
Hmm.
testosterone and some other things.
We've just accepted the fact that we get old, we get sick,
Yeah,
and we die. You don't you're gonna hopefully we all have the chance to get old, but being sick does not have to be part of the equation, right?
no
And
doubt.
so and but we've just accepted that as a
Mm.
part of life. But I love
Yeah,
what
because
we're
we get told
doing.
it by
Yeah,
doctors sometimes.
yeah.
Hey, you're just
Or it's
getting,
just left unmanaged. Doesn't
yeah,
really
it
matter.
drives me crazy when people tell me that, well, my doctors told me that's part of getting older, and then you realize
Mhm.
there's so many other avenues that did not
Yes.
even get explored. I mean, it's not like people are shocked to hear that
Yeah,
their,
I know. Yeah.
internal metabolism is not
Yes.
optimized, right? Because
Yeah,
they feel it and they know
they
it.
do.
They're
Yeah.
just shocked that anyone cares.
Yeah,
You
that's
know, that
right.
you're actually
That's
wanting to
right.
work with them on it, and once you establish that, yeah, absolutely, we can work on this. It's not just all about, you know, Ozempic for everyone, or
Mm,
there isn't a magic panacea for everyone. It's work, and when you break it down, and you have a nurse that's coaching you, and you have a team that actually knows your name and cares about your wins,
mhm.
then that's what makes Thrive unique, and that's very important because I wanted to include that in there so that it's not just this interview with with a
Mhm.
health professional,
Right.
the way that happens pre-surgery. You're just there
Yes.
and the
Yeah.
person's just grilling you with 15 questions. You don't even know what these questions are all about. Rather, it's
Nor do you want
motivational.
to answer them
I
at
know,
that
right?
time.
Yeah, it's very like intimidating, I think people have told me. Whereas this is more about relationship building,
Yeah.
it's more about building the rapport, building the
Mhm.
trust, because there may be some hard news coming,
Mhm.
behind, like, hey, you need to be thinking about making some serious life changes, for example, and you don't necessarily just want to hear that from someone you don't trust,
Well,
and
also
so,
that trust is important because
mm,
to really get to the correct spot, you need the patient to be able to feel comfortable enough to communicate things that they may not want to necessarily reveal to just anyone, right?
that's right, that's
So,
right.
yeah.
That's right. So when they come to see me, they know what they're about to hear because they've heard it once or twice. And then I usually just reframe it as, "Oh, wow, this is the first time anyone's ever talked to you about, your
Uh-huh.
diet or and they're like,
Uh-huh.
"Well, I kind of know." And then but when they're sort of, informed,
Hmm.
then they oftentimes will make changes so that they
Hmm.
can, they have good news to tell me.
Yes.
They'll say, "You know what? I have heard this as the nurse and I have had a couple of
Mhm.
sessions, and let me, before you launch into your,
Yes.
let me tell you what I've done. It's so predictable, and because as a patient, you really want to show your doctor that you're serious about your health and you're at least
Yeah.
taking those initial baby steps. And so yeah, it's always good when you can start the conversation with a win, even if it's
Yep.
just a teeny win, before you start, blasting out the prescriptions.
'Cause I don't even know if you realize the importance of what you said, but in terms of having the patient who wanted to share that good news with you before you even started talking. And I think, this is not specific to Thrive, but it is specific to our model. Those of us, let's say, that don't have access to a health center like this, um, those of us who have had visits with physician, did we ever really feel
Yeah,
like we wanted to tell them some good news?
it's
No,
true.
because the
Mm,
relationship is so transactional. They don't know you, you don't know them. When you go back to your doctor who's been, is invested in you. So
yeah,
you want to prove to them that as a patient, you're worthy of that investment.
it's true.
That's a very powerful dynamic.
It's never a hopeless cause. We can
Exactly.
reframe the
Yeah.
health back into, patient specific goals, and then, those wins, they snowball.
Yes, and
And
because
so
they matter to them, right? So
and they
you're
matter. Yeah,
not
so
just
right.
just
Yeah.
saying this is your goal, do it, because it may not matter to
Right.
them.
And the re-education is never done in a punitive way. It's done in a,
Mhm.
hey, it's done in a wholesome way. Did you even know that we can treat this differently, or did you
Mhm.
even know that all of those side effects, that you've been told, or we have a new approach. There's actually a remission possibility sub pathway in Thrive. And people are like,
Mhm.
well, what's that? Well, it's where we bring up the concept of getting rid of their diabetes. And that
Mhm.
gets people very excited. Like, I can get rid of
Yes.
this? Like, you can
Yeah.
absolutely put this into remission. It may not
Mhm.
be like tomorrow, or it may not be
Right.
easy, but it's an option if you're curious. And like, well, I am definitely curious about getting rid of my diabetes. And and then we have one of those for heart disease, and we have one of
Yeah.
those for, just the concept of insomnia. Like, we can we
Yes.
can we can deal with this. This is not necessarily something you're stuck with forever. Um, and it's something as simple as optimizing their progesterone or their thyroid or something, or their
Mhm.
cortisol. and
Yep.
and so it's kind of those sorts of um, you know not not like low-hanging fruit, because they're not necessarily easy things, but they're concepts that get patients excited and they get fired up. Like, if you can help me lose 20 pounds, I am yours. Like, I
Yeah.
will do anything, right. I'll tell you anything else. I'll follow your advice, because no
Mhm.
other doctor has ever been successful at helping me lose
Mhm.
weight. So I recognize that Thrive is not necessarily a panacea that just works for everyone. They
Yeah.
have work to do. But ultimately, it's this sort of, if you're willing to do the work and learn about X, Y, or Z, you have a much higher chance of getting to your health goal, which may be losing 20 pounds, or it
Yep.
may be, getting off of 3 of the 9 medicines you're
Yep.
on. Like, you have
Exactly.
to really define what it is that gets the patient fired up. And I can tell, I mean, the patients are extremely grateful for their employer-sponsored,
Mhm. Yep.
primary care option. I hear it every day. I'm
Yep.
almost numb to it now because I've heard it so much. But every now and then a patient will look me straight in the eye and go, "No, I can't believe I get you."
Yeah. Yeah.
And I don't
Uh-huh.
have to pay, and I don't have to, I don't have to
Yeah.
worry about things, and
Yep.
you guys have medications here on site, and
Mhm.
I can get my hormones tested. Like, really?
Yeah.
Because I've been told, like, that's like off the table for me. There is real dollars involved.
Mhm.
I mean, huge shock. Healthcare is getting not cheaper,
No.
and the complications of not taking care of your health at age 40 and
Mhm.
having that completely out of nowhere heart attack or stroke at age 50 is absolutely
Mhm.
devastating to anyone
Yes.
who's having to foot that bill, because you have lost time and lost wages,
Yep.
and the cardio rehab and all sorts of things, and
Mhm.
and that's just talking about silent disease, let
Yes.
alone actual complications of diabetes and
Mhm.
etc.
It's the holy grail of data is quantifying the path not taken, right?
Exactly, yeah,
How
the
do you
road not taken, yeah.
quantify the heart attack that didn't happen, the person who never went from pre-diabetic or even approaching pre-diabetes, and they never approach pre-diabetes or becoming a full-blown diabetic. So there's savings in all of that, right?
Yep.
And so the Thrive helps give that information about what was avoided, right? And I think and how that patient is how they are on this the spectrum of any of those states at any particular time. And I think that is, it's definitely not a side benefit because we always have our eye on that, but it's
Absolutely.
certainly something that's been able to push us forward in having uh, specific data to back up those statements because that has been the holy grail in terms of proving how primary care works.
There's no doubt. I couldn't have said all that better. Yeah, I look forward to, giving you updates very frequently as to sort of
All
where we're
right.
headed with this. But it's like the team's excited about it. I'm very,
Yep.
very excited about it. And
Yes.
anyone you get to show this to should instantly recognize it as something different, as something modern, something
Yep.
that is in keeping with the changes that we're seeing in AI and the changes that we're
Yes.
seeing in healthcare. It keeps up with that level of
Yes. Yep.
advancement, and
Hmm.
that's again a challenge. But I think we've taken the challenge on, and I
I think
really
so
feel like
too.
we have a product that is absolutely unique
I
and
agree.
hopefully changes a lot of lives. I think we've